Okay. Good evening, everyone present here. I, Ruchasmita Dev, welcome you all for this session, Demystifying Leukemia and the Importance of Bone Marrow Donation. So let me introduce Core Diagnostics. Core Diagnostics is the largest high-end diagnostics laboratory in India with international roots in the United States and various other countries. We have about 3,000 prescribing clinicians across 200 cities in India. We are the fastest growing and the largest high-end clinical laboratories in India. Now, I would like to invite Nisha, Senior Associate with DKMS, to introduce us DKMS BMST.
Thank you, Ruchasmita, for that introduction. Thank you, everyone, for being here. A very good evening to all of you all. Thanks for both the doctors for being here as well. A little bit information about DKMS BMST. So DKMS BMST is actually two NGOs brought together. DKMS is one of the largest internationally known donor centers. You will get to know what this means and what blood stem cell donation also means towards the end of this presentation, hopefully. So they've been doing this work for a really long time, and they wanted to reach out especially to help patients of Indian descent. And that's when BMST came into the foray, because BMST is better known as Rotary TTK Blood Bank, and it stands for Bangalore Medical Services Trust. So they're very well known and recognized with awards for their work in transfusion medicine, with blood donation camps that they organize, and especially their help for thalassemia children and other blood disorder patients. And both of them, DKMS and BMST, came together especially to start this venture in India to help patients of blood disorders and blood cancer of Indian descent or Indian origin. So as an NGO, what we do is what you're witnessing here today. We promote education about blood cancer and stem cell donation and how easy it is. And we spread awareness about the same. Who is informed and committed, we register them to be part of this international registry, as we call it, of lifesavers. So whenever you're called upon, you can go forward and donate your blood stem cells to help patients in need. And we also facilitate these donation processes throughout the world. And for anybody who wants to engage with us a step above being a blood stem cell donor or a potential lifesaver, you also train them and mobilize them, and you can help us as a volunteer to help spread the good word. Next one, please. So DKMS has been doing this for a long time. Like I just said, we started out in 1991 in Germany when our founder, Dr. Peter Haaf, sadly lost his wife to leukemia. And her last wish was that no other patients like her should have to come to that predicament where she went through the whole unrelated donor search and could not find anybody. So that was the heart of where DKMS started out in Germany, where Dr. Peter Haaf, after his wife's demise, started building a registry to include everyone who's informed and committed on this list of informed potential donors. So after that, we grew in numbers and all over the world. We are now in USA, Poland, UK, Chile, India, and from this year in South Africa as well to help patients there. We launched on the World Blood Cancer Day on May 28th. So we're now in 7 countries to help more and more patients and reach more patients. And thankfully, we've been able to register 10 million of these informed donors. And please do keep this number in mind because Indian representation is something that you want to weigh against this number. And we've been able to facilitate 85,000 of these stem cell donations all around the world. Wherever the patient is, we've been able to help them so far. Yeah, now I will hand it back to Ruchi. Thank you.
Thank you, Nisha. It's good to know about DKMS BMST. Now, I would like to introduce our speaker, Dr. Astha Gupta. She has done her DM hematology from DM hematopathology from AIIMS, New Delhi. She is also trained in molecular hematology from Tata Memorial Hospital, Mumbai. And currently she is working with Core Diagnostics as lead hematopathologist. Dr. Astha, I would request you to please proceed the session.
Thank you, Ruchasmita, and thank you for this opportunity to be a part of this wonderful awareness program that we are doing. And I'll be just briefing about what are blood cancers. So, good evening, everybody. In general, what is a cancer? Cancer is just an unwanted and uncontrolled proliferation of abnormal cells. Cancers can be from the blood or it can be from the solid organs like breast, prostate cancer and all. So we'll be focusing on leukemia, lymphoma today. And blood cancers are basically the cancers of the blood, bone marrow or lymph node which affect the normal blood cell production or function. And before we come to the cancer part, we should know the normal components of these tissues. So blood and the bone marrow, the three main components will be the red blood cells, which are mainly for providing the hemoglobin to the whole of the body. Then we have the platelets, which are the fighting part of to stop the bleeding, and the white blood cells, which are required to fight against any infection which invade our body. And for the lymph nodes, the main important components will be the B and the T lymphoid cells, which are again for fighting against the infections. So this is a bone marrow, which is inside a long bone, and from this in bone marrow reside the bone marrow stem cells. And for stem cells, we will be discussing further. And from stem cells, they will then differentiate into the normal components of white blood cells, red blood cells, and platelets, which will then function in our body. So next. Yeah, broadly the blood cancer will be of three types. We have the leukemia, which is the cancer of the white blood cells, and it arises mainly in the blood and the bone marrow. The second will be the lymphoma, where the cancer starts in the lymph node. This lymphoma can spill into the bone marrow and blood as well, but the starting point is the lymph node. And the third is the myeloma, which is the cancer of the plasma cells, and again it starts in the bone marrow. So, since this is a leukemia awareness program, we will be focusing on leukemia, and leukemia is basically, as I told, that whenever there is a cancer of the blood and the bone marrow, there is a rapid production of the abnormal white blood cells, and whenever these are called as leukemia cells. And now whenever these leukemia cells are multiplying like uncontrollably, they will try to suppress the normal cells. So as you can see in the slides, there is a normal blood where there are, this red part is the RBCs, which is responsible for hemoglobin, the WBCs, and small things, these are the platelets. So on the right side, as the blast increase, they will try to suppress the normal cells. So the red cells will decrease, which will lead to anemia. Your normal WBCs will decrease, which will lead to the inability to fight from infections, and hence there will be symptoms like fever. And platelets, because they will decrease, so the patient will complain of bleeding because of that. Yeah. So in nutshell and broadly, leukemia are of two types, acute leukemias and chronic leukemias. Acute word means that the patient will have a short history, will have a very fast and a rapid development of symptoms and the signs, and they have to seek the clinician for that. And chronic leukemias will have a longer duration of symptoms. They will have slowly progressive development of all the symptoms. And each leukemia can be of lymphoid type, which arises from the lymphocytes, and the second is the myeloid type, which arises from the myeloid cells. And this is not an all-in-one phenomenon, but usually an ALL is more common in children, but they can be seen in adults also. And AMLs, which are acute myeloid leukemia, are common in older age. So, yeah. As I was talking, explaining how the blast cells they increase and they lead to the suppression of the normal cells, and that will explain what are the leukemia symptoms. So the patient will develop fever. Why? Because the normal WBCs will come down and they are not able to function. So we will get infection, we will get fever. The patient will be fatigued because there will be anemia. The patient will have weight loss, nausea, skin rashes, and many other symptoms, like there will be an increase in the size of lymph nodes, which is called as lymphadenopathy. There can be an increase in the size of liver, spleen, which is called as hepatosplenomegaly. And there could be, and in acute leukemias, these symptoms can develop as fast as in a duration of like 15 to 20 days to approximately 2 to 3 months. And chronic leukemias will be like 6 months to 1 year. And obviously it depends on how fast or how early the patient has actually consulted a clinician about it. So what is the lab's role in this? So the lab's role is basically in the diagnosis of the leukemias. And if broadly we consider that it is whether it is AML, ALL, CML or CLL, the patient when goes to the clinician, he suspects leukemia, they will do the CBC, which is called as complete blood count, where will we come to know about the hemoglobin, what is the total leukocyte count, and one thing which is called as peripheral smear examination, where we'll try to look whether there are any abnormal cells which are present or not. And sometimes in leukemias, the abnormal cells are not present in the peripheral blood and they are present in the marrow. Bone marrow examination is an important part of investigation of most of the leukemias. And the second thing, when we want to know whether it is myeloid or lymphoid, the flow cytometry plays a very important role. Flow cytometry will try to characterize these cells to which lineage it belongs, because the treatment is drastically different for the two. And along with that, this is just the diagnosis. The important part which the clinician has to know is the prognostication of the patient, and this risk stratification is done by various molecular methods like PCR and the cytokaryotyping and the cytogenetics method, which includes the karyotyping and the FISH. So the whole diagnosis and the risk stratification along with the clinical features, the final diagnosis of the leukemia is made, and then the clinician will decide what course of the treatment or the protocol to follow. And then obviously in like example in ALLs, the standard is that after the induction therapy, there is something which is called as MRD, or after consolidation. MRD means the minimal residual disease. That is an important, a very important prognostic factor which has to be looked upon, and by flow cytometry and by molecular methods we look at the MRD, which will help in the further deciding the course of the treatment and how the patient is going to perform. So the laboratory plays a very important role in diagnosis and the prognostication of the patient. And yes, the treatment, over to the clinician, Dr. Sen.
So now I would like to invite Nisha. Nisha, you can proceed.
Yes. Thank you. Great. So I thank you, Dr. Asta, for sharing about blood disorders and why, especially leukemia, shedding a little bit light about that. And I don't think we can, that's one question that we always get as a registry. What is the source, or like what should we do to stop it? So that's the key, that there's no one thing that we have found out that will actually stop leukemia from happening. Thank you for that. So why we need people on this registry that DKMS BMST is making? Why do we need lifesavers, and what are stem cells? So before we go into that, Dr. Sen will be able to articulate that better than me. So we have a very short video to share with you, the outcome of anybody registering as a blood stem cell donor and what will happen. So this is a story between a lawyer from UK. His name is Harshil. He registered in the UK. He's of Indian descent, for context. He's of Indian descent, and he registered as a blood stem cell donor when he was in Harrow in UK. And he so happened to come up as a match for a thalassemia patient. His name is Vansh, and he's from North India. And the beautiful way that registry worked is that it brought them both together, and Harshil gave a second chance at life to Vansh. So I will share a small video with you all. And you can see how they both ended up helping each other.
जब मेरा बेटा जैसे हुआ तब ठीक था, बिल्कुल नॉर्मल जैसे लगता था। जैसे थोड़ा बड़ा हुआ तो वीक लगता था मेरे को, थोड़ा फेस भी येलो लगता था। जैसे बीच में एक बार थोड़ी इसका तबीयत ख़राब हो गया तो हमने डॉक्टर से चेकअप करवाया तो ये बच्चा थैलासीमिया निकला हमारा। तो हमें बड़ी चिंता हुई कि हम अब क्या करें। तो डॉक्टर ने कहा कि इसका ब्लड ट्रांसफ्यूज़न होता है। तो जैसे हम इसको कुछ टाइम बाद ब्लड चढ़ाते थे तो ब्लड चढ़ने के बाद ठीक हो जाता था, कुछ दिन हुए फिर वीक लगता था।
तो हमें बहुत दुख हुआ, बहुत फील हुआ। अभी आगे ऐसी कोई दिक्कत नहीं होती। आजकल इसका ट्रीटमेंट आए हुए हैं, तो आप ट्राई करो, भी ट्रीटमेंट भी हैं। फिर हमने इसका ब्लड ट्रांसफ्यूजन शुरू किया दिल्ली से, तो 7 से 15 तक फिर इसको ब्लड चढ़वाते रहे हम।
Before the transplant, I used to look like very weak. All the neighbors and all my friends tell me that you look very weak, what's the problem? Make me so irritated at that time.
My first interaction with DKMS was actually at a local community centre where my mum volunteers on the weekends. DKMS had a donor drive stall where they set up, and they were looking for potential donors for patients they had in mind. So I decided to give my DNA sample on the spot to the stall. It was about 3 years later when I had a phone call from DKMS explaining that I might be a potential match for a patient.
When Harsh said that, he's the possible match for somebody, at that time, we didn't know anything about the family or anything, but somehow we felt connected, and we were just saying that, thinking about the parents, how they must be relieved to hear that there is a match for the child.
The impact you can have on someoe's life is so significant, and the effort it takes you to do this is really minimal.
बहुत खुशी हुई भी आजकल इतनी जागरूकता हो गई है भी कोई दिक्कत भी नहीं आता उसको स्टेम सेल देने में, और दूसरे का जीवन बच जाता है।
When you think about someone sitting in India whose life is in danger and the potential that he could be saving that person's life and giving them a future that perhaps they may never have if he doesn't go through with it, I think it puts everything into perspective.
इसका हमने ट्रीटमेंट करवाया, स्टेम सेल ट्रांसप्लांट हुआ, तो हमें बहुत अच्छा लगा, जैसे अब वंश बिल्कुल ठीक है।
To find a match is difficult even in the family, but to finding somebody completely from the different end of the world that who can help in this way to give a gift of life, I would think that way. It's amazing feeling.
Everything was totally worth it, and to hear now that the child is doing well and it was a success, there's no greater blessing than being able to be put in that position and have the opportunity to save someone's life and give someone a future.
I used to tell Vansh there is a genetic twin for him in London and he's more like him than me because they are genetically 10 by 10 match.
I donated to someone in India, which is a country that's very close to me. I would definitely donate stem cells again.
After the transplant, I was like very okay. I can do all the things that my friends can do, all the things that a normal child can do. I can go to school now, I can play, I can do everything that I want, and that's just because of that donor who has given me new life.
Ladies and gentlemen, put your hands together in welcoming Harshil up on stage.
मेरे को लगता था मेरा बेटा ठीक हो जाएगा, मैं इसकी लंबी आयु की दुआ करती थी हमेशा, और मेरे को डोनर मिला जैसे बड़ी खुशी हुई। मैं डोनर की बहुत आभारी हूँ, मेरे को मिलने की बड़ी उनसे खुशी है। DKMS का धन्यवाद करती हूँ जिन्होंने डोनर ढूंढा और बच्चे को अच्छा जीवन मिला।
So that was a story of how Harshil ended up helping Vansh. So after this, now I call upon Dr. Sen to help us understand what are stem cells and why we need lifesavers. So before we start that, a little bit information about Dr. Sen. First of all, thank you so much for your time and resources for joining us here, and a little foray into Dr. Sen's career. He's one of the foremost stem cell transplant physicians in India, and he's the only internationally accredited BMT unit inspector in India. He started out his career in pediatric hematology and oncology in UK and was working there for over 12 years. He's also a teacher and examiner for the Royal College of Pediatrics in UK. With numerous publications and various national and international conferences behind him, he was also chosen or recognized as one of the top doctors in Mumbai, both in 2019 and in 2020. So Dr. Sen, I must digress that most of this was put together after stalking you on Instagram. So please do find him there. You will find many inspiring stories there about his patients and about the amazing work that not only him, but many other doctors also sacrifice literally to do for us. So now I call upon Dr. Sen to please share about stem cells and why we need life savers. Thank you.
Thank you. Thank you so much for that more than kind introduction. Thank you so much. So I thought we will talk about stem cells, and this can be a new concept, a new word. And what are stem cells? If we think that these stem cells basically are what we can think about are extremely primitive stem cells. So to kind of like to talk about them in greater detail, you know that our entire body is made out of cells. So skin, that's called epithelial cells on our skin. Our muscles have got muscle cells. Our eyes have cells that are related to how we see things, that vision. Heart has cardiac muscle cells which deal with the heart beating. Then you have special liver cells in the liver. So each and every cell of the body is different. There are nerve cells in the brain. But if we trace those cells back, actually, and this is fascinating, all of these cells actually come from one or a very primitive kind of a cell called a stem cell. And these stem cells have two amazing properties. Number one, they can multiply endlessly. So which means one cell can lead on to a second stem cell, can lead on to a third stem cell, which is kind of what we call propagating and replicating at the same level. And second, they can actually change into many other different kind of stem cells. So that stem cell can turn into a nerve cell, a heart muscle cell, a blood cell, cardiac cell, whichever one. So it's the primitive one cell from which all our body cells can come from. Next slide, please. But the cell that we are most interested in is called a hematopoietic stem cell, which is the stem cell which changes into a cell that will lead on to make blood, basically. So where do we get these hematopoietic stem cells? It's a long word, which basically means it's a stem cell which can lead on to develop into blood, into white cells, into platelets. If you remember Dr. Asther's presentation a few minutes ago, she talked about blood cancers and how they can arise from these three types of cells. And that's the kind of stem cells we are talking about. So where do we get this? So for an adult person, we can collect and we can get the stem cells from the bone marrow. And sometimes we can also collect it from what we call the peripheral blood, that's in the blood circulation as well. If we have a newborn baby, the newborn baby's umbilical cord can also be a very rich source of these stem cells. Now, at a scientific basis in the lab, we can also collect it from a petri dish, where if we have these what we call embryonic stem cells or induced pluripotent stem cells, those can be induced to develop into hematopoietic stem cells as well. But the current application of these induced pluripotent stem cells in therapy is quite limited. So at the moment, when we talk about treatment or therapy, we really are talking about stem cells in an adult coming either from the bone marrow or the blood, or if we manage to collect cord cells, then that's from the umbilical cord from a newborn baby. So what really are stem cells? So if we are to answer this, we need to look at where the stem cells are being made. And for that, we need to look at the bone marrow. So what is bone marrow? The bone marrow is the soft part, the soft tissue, right at the center of our long bones. And it is here in this environment that these primitive hematopoietic stem cells gradually mature, and they mature into all these three different types of blood cells. The white cells, which we talked about, helps you in fighting against infection. The platelets, the tiny cells that helps to clot up any kind of breach in our skin or in our blood vessels. And the red cells, which is what helps us in transferring oxygen and nutrients all across our body. So those stem cells in the marrow is from where it spreads out in the circulation, developing into all these three kinds of blood cells. But what we are talking about is basically talking about DKMS, talking about BMST, talking about being a donor. Why are we talking about that? We're talking about that because if you remember Dr. Astha's presentations, she talked about diseases like leukemia, like lymphoma, like myeloma. So how do we treat these diseases? And then we can talk about non-cancerous diseases like thalassemia, aplastic anemia, sickle cell disease. The common thread that runs across all of these diseases is that they are all basically resulting from abnormal marrow, abnormal stem cells that has somehow become disordered. So say for example thalassemia. In thalassemia, the body doesn't produce enough red blood cells, and these patients, like you heard the story, these patients need blood transfusions over and over again. Something very similar happens in aplastic anemia, where the patients don't make red blood cells, don't make platelets, don't make white cells. So without actually giving them transfusions and lots of platelets, they actually don't survive. There are some other autoimmune disorders which are like diseases where the body turns against itself and starts destroying the cells, its own cells. So in all of these, the bone marrow doesn't function properly. And then you have the blood cancers, which we talked about, where also the bone marrow is disordered. It's not producing the correct kind of stem cells. So what do we do? For the cancers, we can give them chemotherapy. And then, of course, we also have radiotherapy. But sometimes, in spite of giving a patient maximum chemotherapy and radiotherapy, the disease might be coming back, or we might have a situation where we know that it's a specific type of cancer where unless we do something extra, the patient will not improve. And what is that? And that's what we talk about. Um, So if we talk about what's the reality about blood cancer in India, so blood cancer is very prevalent in India. And if for somebody who is not responding to chemo and radiotherapy, that's when we can actually talk about getting a stem cell transplantation. But in order to do a stem cell transplant, we need a donor. And the donor needs to be an absolute genetic match, which is what you heard in that video, needs to be a genetic twin, a 10 out of 10 match for our patient. And where do we find such a person? We can look for him within the family, which is most of us would do. But actually, if we look in a family, only 25% of patients would be able to find a relative within their family who matches to the patient, which means more than 75% of our patients not be able to find a match in the family. And that's when we look outside in the greater world to see if there is a genetic twin somewhere out there. And in order to find what do we match for this thing called a tissue match or an HLA match, the full form of which is a human leukocyte antigen. But for ease of remembering, just remember we need an HLA match or an HLA typing to be done. The problem is that in the human beings per se, there are more than 25,000 different types of HLA types. So you can understand it's quite difficult. An easy way to understand this is to think of that something we know often very well, which is blood groups. That whenever we need a blood transfusion, we want to get somebody who has the same blood group as us. So a patient has a A blood group, needs a donor who's also an A plus. Somebody who's an AB positive needs an AB positive. So all in all, there are four blood groups, A, B, AB, and O. And then you can have an Rh positive and an Rh negative. So overall, every human being in the world can only have 8 distinct types of blood group. When you come to HLA, there are some 25,000 different types of HLA types. So you can understand it is quite an undertaking to be able to find a genetic twin in the world. Next slide. And the other issue is that these genetic twins, it also depends from where you come from. It depends upon the family, it depends upon the family tree. So say, for example, if we talk about a specific genetic identity, say, let's say we talk about a Gujarati community. So the type of HLA types that they would have would be slightly different, say from a northeastern family in Guwahati or Assam. And then, of course, the identity of somebody like that compared to somebody who's staying in Arkansas or in somewhere in New York City would be very different. So which means that if I have a patient who's in India, I'm much more likely to find a donor if my donor pool is also from India than compared to if I find my donor pool who's based out of US. So which means that whenever we look at DKMS, BMST, the main goal of it is actually that they need to have as many stem cell donors registered as possible in their registries in order to give all our patients a second chance of life. Next slide. What happens today? Why is today special? Today is special is because today is a World Marrow Donor Day. And this is celebrated all across the world on the third Saturday of September, which is to thank all the 37 million voluntary donors who have signed up across the world saying that they are willing to donate marrow or donate stem cells to anybody whenever they need a transplant. It also gives us a chance to explain to everybody, including patients, including donors, including volunteers, to explain what is the impact of having a stem cell transplant that's going to have on the lives of patients and general spread awareness. Somewhere or the other, each and every year, 20,000 patients do receive a blood stem cells from somebody. The ground reality also is that not every patient finds a match. And ask me about it. This is something that happens to me in each and every day. Only this week, I've had at least 2 patients of thalassemia whom I had asked for in the wider community to find if they have a match, and unfortunately the answer came back as no, that unfortunately not in the family, not in the wider world. And when we say wider world, we are not just looking at donations in India, we're really looking through DKMS, we are looking at donors who might have registered on the donor pool in Germany, in USA, in Chile, in South Africa. And this happens that sometimes in spite of us trying to find a donor across the world, we may not find a donor anywhere. Next slide. Why does present just 0.03%? As you can understand, for us, it means that we have a long way to go. If we are to approach the level of voluntary donors that is in the other countries of the world, like USA, like UK, like Germany, we need to get a lot more people like you to volunteer to come forward and agree to donate your stem cells if and whenever you need to. And that is because though the majority of the world population is in those countries in red, and you can see Africa is there, South America is there, Russia, Asia, Australia, only in the whole registry, only 1/3 of our donors are actually from those countries. And if you look at India, as I said, it's even worse. It's less than 0.0%. That's quite low. So which means that this is that step that I have to ask everybody to come together, that we need a lot more people to step forward. We need a lot more people to agree to be voluntary donors, because we believe that with your help, we can register much more bigger numbers. And we need donors who are local. We need donors in India for Indian patients, because that's where we can get a lot more matches. Thank you. So Nisha, are you talking about the donation process?
Thank you, Doctor. Yeah. So before I hand it over back to you, actually, so I will just go a little bit about the process of how DKMS BMST goes about registering these donors and what we call a donor journey. You can see it on your screen right now. So Dr. Sen was saying about signing up as a potential lifesaver. What that means is that towards the end of in the next slide, I'll be sharing a link where you can sign up online, given the COVID situation. We've moved on to online registrations. Otherwise, you would see us, face to face, you would receive this awareness in person. We'll answer all your questions and queries, any concerns, and you would fill up a physical form. But now it's translated to the virtual format of it. So you go to the link, you fill out a form, and you will basically be asked to give a cheek swab. So this cheek swab, I hope you can see, this is a sterile swab, which there are 3 in this packet, which you will get at your house. You will receive the swab kit after you fill out your registration form on the website. And even in the next slide, you'll be able to see there'll be a cotton bud like this. You just have to take this and swab the inner walls of your cheek and your gum lining. That's about it. You just swab this and you send it back to us in a business reply envelope that's already paid for. You just have to drop it at the nearest post box. You don't have to interact with anybody. And with that, your step 1 of registering as a blood stem cell donor is done. And later your HLA will be typed and you will be available on this global list of lifesavers that we're speaking about. If you come up as a match, you will be in this registry till your 61st birthday. Let's say you come up as a match in the next 7 months or even the 17 years. DKMS BMST will get in touch with you. We will let you know that a patient is in need of your help. Depending on the situation and convenience at that time, we will ask you for a little bit of blood to confirm that you are indeed the match for that patient. When I say a little bit of blood, I mean about like 15 to 20 ml. Both the doctors, please do correct me if I'm wrong. So you can just give a little bit of your blood to confirm that you are indeed the match. And with that, your step 2 is done. And if the patient and everybody on the patient side is prepped and okay to go forward with the transplant, is when you will move to step 3, where you will be given a thorough medical health checkup. This is to make sure that your health or the patient's health is not compromised in any way because of the donation process. And afterwards, all the checkup and your counseling with the concerned doctor is done. You will then move on to the donation process, which is called the peripheral blood stem cell. So you have stem cells circulating in your peripheral blood itself. So just like how you would donate your blood or your platelets, which is more relevant, you would be connected to a machine called as apheresis. And from one side, your blood will go into the machine. It will just filter out and take out your blood stem cells. The rest of your blood will be given back to you. So this is the peripheral blood stem cell collection method. And the separate bag of concentrated blood stem cells that you've donated will be transported to the patient wherever they are for transplantation. So during the PBSC method, like Dr. Sen illustrated, your stem cells or hematopoietic stem cells are stored in extra and produced whenever your body needs. And they're stored in extra inside of your bone marrow. So whenever there's a need, your body produces something called as GCSF to migrate these extra stem cells to your circulation to use them as whatever cell it needs. So you might have heard even when you donate blood, it's good because you'll get new blood. So this is the process that happens. When you donate your whole blood, your body produces GCSF to migrate blood stem cells that convert into whatever your blood needs or your body needs. So this GCSF will be given to you in a form of an injection. It will just be given on your skin for 5 days. You can take it at the comfort of your home, starting of your day. You can go to work while you're getting this. So there'll be 1 injection per day. On the 5th day, which is your last day of injection, you will get the injection in the morning and we'll ask you to come to a hospital or a very well structured blood donation or a blood bank near you, where the apheresis machine will be there and you can make the donation. So concerns about GCSF is addressed in the second half or like the below of the slide, where we haven't, even DKMS researchers and anybody else out there, researchers have not found any long-term side effects of this. It's something that your body anyway produces to do the same work. You will be given a little bit more to encourage more cells to migrate to your peripheral blood. Yeah. So 3 easy steps to complete your first step of registration or the donor journey. You can go to dkms-bmst.org/register. You can fill the web form. And when you say where you got this information, you can just specify donor drive so that we know how you heard about us. It's just for us to quantify. And after you do that, you will trigger a request for a swab to be sent to your house. As soon as your request is given, you will get a text message and also an email saying that we've received your registration, and a swab kit will be sent to your house. So like I showed, you just use the swab. and do your swab. The swab kit will come with a welcome letter, which will give you a link to a video. You can follow all of this and also get in touch with us if you have any kind of questions. Our contact information will be given in the swab kit. You just have to send the swab kit back to us. This is very important that you don't keep it to yourself. Share your swab kit with us, send it, and then you will be on this list or a waiting list to save a life. So these are the 3 easy steps that you can do to become a potential donor. We do have a eligibility criteria in place. This is solely to make sure that you or the patient are not harmed in any way during this whole process. Also, your health for yourself first, because if you need attention, then probably we should take care of you first. So the eligibility criteria that we will observe even when you go through the online registration is, all around, you should be in good health condition, a healthy adult, definitely above 18 years of age while going through the or registering to the web form, and less than or of 50 years on the day of registration. And like Dr. Sen said, you should be in India so that, or preferably living in India so that we can better coordinate with you, and not already registered with any other stem cell registry. This is just to avoid any potential confusion when you do come up as a match. From the patient's perspective, they would think that there are 2 or more matches, when in reality it's just one donor, which is you. So to avoid any other type of miscommunication, misunderstanding, it's best that you register with one stem cell registry that's listed globally. And any of the exclusions or conditions that you see on the right side of the eligibility criteria, there's a very real chance that you can pass this on to the patient who's already immunocompromised. So it's not advisable for you also to go through the donation process. So these are the checks in place to register as a potential donor. So these are the swabs in case you weren't able to see it clearly. There'll be 3 swabs, sterile swabs. You just rub them in the inner wall of your cheek. If you like this presentation, or the link to the YouTube video is already given, you can search for it on YouTube also, saying DKMS BMST how to swab. This video will show up. So you just put this in this envelope and you send it back to us. So this is how you complete your registration to be a lifesaver in waiting. So we do observe all the donor data privacy norms as mandated by World Marrow Donor Association, which dictates our guidelines and mandates that we have to observe. And also the GDPR, EU GDPR actually, General Data Protection of the European Union, which is no more. And also according to Indian standards, we also comply by the Information Technology Act. So this is a completely voluntary act that you're doing to sign up. If you come up with a match, depending on your availability and then current status, health status, you can go ahead and help a patient. It's in no way that you're being pressured to go forward and help patients, or like saying that you signed up, you should probably go through it. But please do keep in mind that you're signing up and you're coming up as a match is kind of like giving hope to a patient who has already gone through all the options that they have to go on surviving, which is chemotherapy, radiation, and this is their last Hail Mary or chance for them to go on living. So any point in after registering, if you want to withdraw your consent or your registration, you can do so by letting us know with an email, and we will take that forward. So nothing to identify your personal contact or you by an individual will be shared with anybody outside of DKMS BMST. Yeah. So I will hand it over back to Dr. Sen, who will explain more about the donation process and its safety.
Am I audible now? Yeah, okay. Nisha, thank you so much for that amazing. It's really kind of quite interesting to see that with the lockdown in place, we are still kind of managing to encourage people to donate. And I think the whole plan that you can donate using just your laptop and kits being sent to the donors' houses and collection, it's very innovative. And this is the way we all need to accept the situation and work. But to talk about blood stem cell donation methods, there are basically 2 methods by which we collect stem cells. The one that we would be using when the time comes, should the time come that you might be fortunate enough to be able to save a life for somebody, is called a peripheral blood stem cell donation, also called a PBSC. It's called a peripheral blood stem cell donation because we collect the stem cells from one of the small veins or one of the large kind of like major veins of the hand. peripheral blood stem cell, which is different from a marrow collection, which I'll come to later. And Nisha has already told you how we do it. We give this injection called GCSF, which is basically a medicine that actually pushes the blood stem cells out of the blood. I told you the stem cells are in the bone marrow. It pushes those stem cells from the bone marrow into the bloodstream. So what happens is that otherwise we would have to collect the stem cells from the bone marrow itself. Because we are giving this medicine, it multiplies the blood stem cells to such a degree that they spill over out of the bone marrow into the peripheral blood. And that's when we can collect it, just like we collect a sample, we collect it peripherally. But the collection is a little more to it, and I'll come to that in a few minutes. The other way to collect marrow stem cells is by collecting it from the marrow itself. And this is actually a surgical procedure that's done under anesthesia in an OT theater. And we would still do that. I mean, for example, last week and coming week, I have 2 bone marrow stem cell donations to do, collections to do, where we would actually take the donor into the theater, and it's a brother of my patients, and we collect it from the marrow. But for the purposes of asking a voluntary donor, we would never do that. We would always ask for what is called a peripheral blood stem cell donation. Talking about that a bit more, Nisha, can I have the next slide? So how is it collected? It's non-surgical and it's safe. So those are the 2 things I want to actually underline over and over again. There is no pain involved. There is no hospital admission involved. There isn't going to be a massive procedure that's going to muck up with your day. But it is, we would ask for 4 hours from you. And it is extremely similar to what a blood donation is like. If you have had a blood donation, if you remember putting in an IV line in one of the veins of your arm, on the crook of your elbow, that's exactly what it is. And what happens? Next slide. Nisha, can I have the next slide? Yeah. So what happens is the blood, oh, sorry, I messed around with my slides. The blood, basically, we collect the blood from the veins in the hand, and we circle it through this machine called an apheresis machine. And what it is, it's got like a spinner, a huge, humongous spinner, and it spins the blood around in the machine, and it spins it into 3 different parts. One part, which is the main red cells, basically are again given back to the patient, but the one part of the cells that we are most interested in is the stem cells. And these stem cells are spun and they are skimmed off from the blood and collected in a bag, and the rest of the blood is given back. So even though you are connected to the machine for up to 4 hours, because it takes that long for us to collect it, it doesn't mean that we collect a huge amount of blood. At the end of it, what we collect is the stem cells only, and the volume of that is hardly about 100 to 200 ml. So actually, you end up donating even less than you would have done if you had done a whole blood donation process. Next slide. One of the main things that we have to do, and we have to ensure that if you have agreed to be a volunteer, it is really upon us to make sure that your health remains our #1 priority, which means that you are right at the center of our universe at that point, which means we really maintain donor safety to the nth degree. We make sure that you are comfortable and you are safe. And we have very specific written procedures, standard operating procedures, which makes sure that your health is always safe all the time when you are going through this entire process. And these procedures, which looks at viruses, which looks at bacteria, looks at safety in our process, make sure that you are safe, and it makes sure that the donor, the recipient, the one who's going to receive the stem cells, is safe. And it also ensures that the rest of us in the entire collection center, in DKMS, in BMST, everybody is very, very safe. What I can tell you is till now, there is no evidence that we've had any such accidental virus transmissions. If you're asking specifically about COVID, there is absolutely no evidence that COVID can be transmitted through blood, bone marrow, or stem cells. I'll take a small example. I basically discharged one of my transplant patients about a week and a half ago. And interestingly, that patient, when I was about to admit him, came up positive for COVID. So we actually had to wait for a week before we took him up for a transplant. He got better. Unfortunately, his donor was positive, so we waited and did it. But then my transplant patient this week had the reverse, that the patient itself had been safe throughout, but his donor, which is her donor is his father. Her father had become COVID positive. He recovered, and we are so certain that COVID doesn't come through the blood and stem cells. We felt absolutely safe to able to collect the stem cells from the father. Why am I telling the story? I'm telling the story because you might have a lot of apprehension that, is it safe for me to go somewhere and donate blood or stem cells considering that there is COVID out there? Believe me, each and every center under DKMST has taken enough precautions to make sure that you are protected all the way through. Nisha, next slide, please. There are a lot of myths about blood stem cell, and it's good to actually talk about them. So one of them, it's like blood stem cells, you donate, you lose them forever. And it's like people sometimes think of it in terms of a kidney transplant. You donate a kidney, that's it, it's gone. You only have the other kidney. No. So blood stem cells, basically, the way I talked about, they repopulate, they multiply themselves, which means that even if you donate your blood stem cells, within 2 to 4 days, they are back. So you haven't lost anything at all. Second, it involves a surgery. No, it doesn't. All it involves is for you to go into the hospital, and all you need to do is just kind of give a blood donation. It's as simple as that. No knives, no surgery, very safe, lasts for 2 to 3 hours, 3 to 4 hours, and that's it, it's done. I can only donate once in a lifetime. Actually, if you're donating stem cells, you certainly can donate many a time, because if you think about the first point, that stem cells are basically multiplying every 4 days. So theoretically, you might even be able to donate every month. However, for DKMS procedure, you will only be asked to donate, provide your service to mankind just twice in a lifetime. That is it. So it's possible to donate multiple times, but we would never ask you to do that. Next slide, please, Nisha. People are worried that my lifestyle is not the greatest. I do a bit of social drinking. I might be a smoker. Does that stop me for being a donor? No, it doesn't. That does not stop you. We do look for other diseases, and Nisha had gone over the donor eligibility there. And if you remember, there are certain diseases we look for, certain illnesses, but things like smoking and drinking are fine as regards your ability to be a donor. People also sometimes worry about, you're going to give me an injection, does that have major side effects? I'll be honest, there's been enough studies to show that the side effects of the GCSF are fairly minimal as regards long term. That is not to say that there will be no side effects at all, because most donors will complain of a bit of a backache. So to be honest, that is the commonest thing that you as a donor might complain of, that after the second or third injections, I'm getting some aches and pains in the body, and a simple thing as a Crocin tablet will sort that out. But long term, no, there are nothing major. I can really reassure you as to that. Next slide, please, Nisha. Volunteering. Nisha,
Yes,
you take over.
I will take it from. Thank you, doctor. Thank you so much for sharing your insight. So after hearing about all of this, and you are motivated to register, thank you for feeling so. And beyond that, if you would like to volunteer with us, the more voices that are speaking about this to share, raise awareness, the better. So I will just share a little bit thing that you can do from the comfort of your home. We're trying to build a very strong network of very informed and dedicated volunteers who will directly impact in saving a person's life. So what you can do is like how Core Diagnostics has come up and organized this webinars or taken this initiative. You can too. You can do it with your office, with your volunteer group, or even with your circle of friends. Just share about this initiative. It really does not take much. You just have to fill up a form and get your score and send it back to us. or you can even give us your social media profile or platform and use it for a good cause. You can find us on Facebook, on Twitter, on Instagram, go through our posts, and you can also help spread awareness in whatever way you can. And like already told, you can organize, propose with your colleges, with your volunteer groups about having a webinar or an awareness session. So those are the few things that you can do from volunteering from home. We are always open ears to many more ideas that you might have about what creatively you can do to spread awareness about this. So I encourage you to take a screenshot of this. My contact information, you can always write to me, or you can find the email on our website. You can write to us there, and we can get a conversation going about blood cancer and how we can step up and be a lifesaver. So today being the World Marrow Donor Day, a day to appreciate people who have already given the opportunity to save a life and have already registered to be a lifesaver in waiting. So I just wanted to share a little bit about our donors. So this is one such case where Dev Jyoti, who was a software engineer working in Bangalore, he receives a very similar or exactly the same awareness session. And after a year after he registered, he got a call that a small child is in need of his help. So after a lot of convincing his family, not him, he was convinced. So he had to convince his family a lot, saying that it's a very safe procedure. There's nothing detrimental to him or his health. The family and his wife agreed, and he was able to donate his blood stem cells here in Bangalore. And the blood stem cells were transported to the patient in Kolkata. So a small girl and Dev Jyoti, the small girl's name is Shia. Both of them met this year on Feb 4th, before all the lockdown and COVID wrecked our lives. So this was a happy thing that happened to us in DKMS BMST. Both of them came down to Bangalore and they met each other for the first time. So these donor-patient meets are very emotional for us because essentially Dev Jyoti has helped give a second lease of life for Shia. So that's a very emotional thing that happens, not only to us, but to other registries also who organize such events. So these are a few more of our donors. Like you can see on the left, that donor had just finished his PBSC donation or blood stem cell collection. Only that concentrated bag of cells that he is holding is the blood stem cells that he's been able to donate. So like Dr. Sen told us or informed us, there's only very little amount of blood that you're actually donating, not your whole blood like you would do with blood donation, your whole blood. Yeah. And this on the right is Harsh. I had the privilege of actually giving him the awareness session and was very happy to see him come up as a match. And he is actually a military officer. And he said that he considered it to be one of his services that he could do apart from being in the military to help another person in need. So he went through his blood stem cell donation this year as well. And hopefully we get to see a day where he meets the patient that he has helped. So World Marrow Donor Day or World Marrow Donor Association observes this day. So there's this very small video that we have compiled together, especially where patients thank the lifesavers or the donors that who have helped them. So I'll just play that now.
Dear donor,
it's hard to describe exactly what you mean to me.
Nach allem warst du derjenige, der mir mein Leben zurückgegeben hat.
You were the one that gave me my son back.
And although we haven't met in person yet,
Never hugged. Chociaż nie znam twojego imienia.
Du bist nun Teil meines Lebens.
You mean the absolute world to us.
we share a special bond that can never be broken.
Jesteś, wprost dosłownie, częścią mnie. Jesteś moim prawdziwym bohaterem.
Cuando supe que tenía un donante compatible, tuve esperanza.
In that moment, the possibility of the future became clearer.
Stop thinking of what might have been.
Y empecé a pensar lo que podría ser.
Zdałam sobie sprawę, że dzięki tobie zaczynam nowe życie.
A life without blood transfusions, hospitals and pain.
Du, das wichtigste Puzzleteil meiner Therapie, war gefunden.
You gave me my life back.
Knowing that someone,
Że jest dziś na tym świecie osoba, która była w stanie zrobić dla mnie coś takiego.
Es un sentimiento indescriptible.
your decision to donate to a stranger,
is a reminder of the depth of your human compassion.
You gave me a second chance, and you asked for nothing in return.
Dzięki Tobie mogłam zacząć spełniać marzenia.
Dank dir bin ich in der Lage, wieder mit meinen Freunden und Familie zu lachen.
Por el colegio, juntarme con mis amigos.
Because of you, I can now be the child I want to be.
I am getting to watch my son grow up to be the most wonderful, funny, handsome boy.
A to dopiero początek.
When I think of you and all the donors in the world, the first word that comes to my mind is heroes.
Dankbarkeit allen.
Nadzieja.
Incredible.
Real life heroes and guardian angels.
When I needed you most, you were there for me.
That choice and the compassion behind it is something we will be forever grateful for.
From the bottom of my heart, thank you.
Gracias.
Danke.
Dziękuję.
Thank you.
Thank you, and thank you to all donors. You are the reason we are here. Love, Rachel.
So yes, I would also like to take this opportunity to thank everybody who's enrolled, even in India, to be a lifesaver in waiting or have already donated their blood stem cells, not only with DKMS, BMST, but other registries as well. They're the true heroes, as you can see with this open letter that patients have written for them. All 27 million of them across the world, we would like to thank them for giving patients a second chance at life. And happy World Marrow Donor Day to all of them. So this was an event that we were able to do last year in a college where we had donor interaction. Sadly, we couldn't do that now. So this is our event to commemorate World Marrow Donor Day. So I just have one last message before we end the session. You can be a superhero for somebody who you don't even know exists and is just waiting for years together, surviving on chemotherapy or blood transfusion, waiting for that one person with that very compatible HLA match, right? So you never know where you can make a difference. And as easy as the process is, you just have to sign up, wait for a kit to be delivered, swab and send it back. And that makes a difference, a very big difference in a patient's life who's been waiting for years together. So please do go to the URL given in front of you. You can also be a lifesaver for them. And thank you for listening to us today and for attending this session that Core Diagnostics and DKMS BMST have been able to do. And thanks for supporting us throughout the whole session. If you do have questions, please do ask us in the chat box. And thank you to Dr. Asta and Dr. Sen for your time and for sharing your knowledge with us. It's really invaluable what you've shared with us today. So back to Ruchi.
Thank you so much for giving us this opportunity. Thank you.
Thank you, Dr. Astha, for demystifying leukemia for us. And thank you, Nisha and Dr. Santanu, for making us understand the importance of bone marrow donation. So I would urge everyone to donate blood stem cell and be a hero. Because if we can make a difference in someone's life, then that would mean success to us. Thank you everyone for attending the session. If you have any questions, then you can type in the chat box and we will take it up. Okay, so there is a question from one of our employee, Mr. Sudhakar, and he is asking if he is already registered with one of the bone marrow donation registry, then whether he can join DKMS. So Nisha, would you like to address that query?
Sure. Thank you for the question. If the registry you're registered with is listed on the global registry, please do visit WMDA website to check if they are listed, or you can go through the email that they've sent you. If not, you can register with us. But otherwise, like I said, it would just cause confusion. If you're already there on a lifesavers list, then you're already there, you're already helping and making a difference. So you don't have to replicate that effort.
Thank you so much for such an insightful session. And I believe we will be able to donate and provide back to the society. Thank you so much.
So I think we don't have that much questions. Either just like you would say in the end of a lecture, I think everybody understood, or there's a lot of questions. So yeah, so I just wanted to leave with a message saying that please do read up about this. I understand that this hasn't, this is a very short session to understand a very new concept. Please do read up more about this. And I think one person has a question, Ms. Sneha. Ruchi, you can ask them.
Yeah, Sneha, Ms. Sneha, do you have any questions?
You can just type it out to us, please. Okay, so meanwhile, while she's typing the question, this question is for you, Dr. Sen. When you are working with a patient, so you can hear me?
Yes, I can.
Okay, perfect. So I just wanted to understand from the patient's perspective, we spoke a lot about what donors or potential lifesavers will have to do. What do patients go through when they decide that they need a BMT or a bone marrow transplant or a blood stem cell transplant? How are they made ready to receive a transplant?
Right. Okay. It's a very good question. And I mean, certainly from the patient's perspective. So really, if we think about it, that we'll be talking about a stem cell transplant. If you remember those slides, when either you have a bone marrow that's not working properly, or which means it's not producing the red cells or white cells, or you have a disease of the bone marrow itself, which means that the bone marrow is working to produce abnormal cells, which is what happens in leukemia, in some lymphomas, certainly in myelomas. So which means what we need to do as a step one, that if you have a defective bone marrow, we need to actually destroy that, because it's like a farm. You cannot plant new trees when that land is overrun with weeds. So you first need to de-weed that farm. You need to dig out to take all the weeds out. And then in the same way, in a farm, that you would actually need to aerate the soil by digging it up and preparing the ground before you plant new siblings, new saplings in it, new small plants in it. In the same way, when you do a transplant, we first need to remove the defective bone marrow. And how do we do that? We do it by using two ways. One is by using what we call chemotherapy, which are basically medicines, which are drugs, which are kind of strong drugs, which actually destroys the bone marrow completely, which means that's what we prepared the ground. In some leukemias, just not only destroys the bone marrow, which is what we want it to do, it's not an unwanted side effect, it's a desired effect to destroy the bone marrow, but the drug also takes care of the cancer elsewhere in the body. Now that we've prepared the ground, that's when the donor stem cells comes in, and those stem cells are then given to the patient just like a blood transfusion. The same way as you receive a blood by getting it into the veins, the same way we give the blood back. And that, in a nutshell, in a very simple way, is what a stem cell transplant is. Actually, that really is a simpler part. It sounds very simple. It's a little more complicated, because after that, what happens, the patient gets, patient's blood counts become zero, and we have to protect the patient from infections for up to 14 to 21 days. Just like after you plant some seeds in the ground, small plants in the ground, it takes some time for that to grow. In the similar way, the donor stem cells takes about 2 to 3 weeks to grow in the patient. So we have to protect the patient for that 3-week period when he's in the hospital, in the stem cell unit, protect him from infection. And somewhere between 11th day to 16th day, we find signs that the new cells have started to multiply in the patient. And that's when we celebrate saying that we have a successful stem cell transplant.
Thank you, Doctor. Thank you for that. So we have another question from Sampurna. I think you can even help us out with this. The question goes, once we register as a donor, should we follow any health practices that would benefit when we actually get to donate? Are there any specific health practices that the registered donor should follow for when they come as a match? How that can help? Yeah.
So if I take the question, I mean, if the question is that if you decided to be a donor, is there some specific health precautions you should take? There are two parts of it. I mean, whether you register yourself as a donor or not, you should try and live a healthy life, get some exercise, really shouldn't really be smoking, shouldn't really do too much drinking. That's the basic thing that we would ask everybody to do. Get some exercise, lead a healthy lifestyle, eat properly. That's what we would say. But if you're asking specifically, is there something you need to do? No, you don't. It is fine. So, which is to say that there is nothing specific you need to do in order to maintain yourself to be a donor. Yes, if and when the time comes that we ask upon you to be a donor, we will be doing our own checkups. We'll be doing a health checkup for you to make sure that you are healthy. And that's okay. But I think the basic thing is we all should try and be as healthy as possible. I know that I should do a little more exercise and dieting, and that's true for most of us, really. But yes.
I'm guilty of being sedentary as well. So, we have another question. I think it's to do with cord blood, actually. Let me just.
How often umbilical cord cells use? That's a very, very good question. And I'll answer it in two parts. The first part is a little bit historical, which is where cord cell transplants came through. And certainly if I were to be asked that question about 10 years, 15 years ago, when I was still working in the UK, I would say cord cells are used very frequently. It's a fantastic source. Now, the issue is that when we don't have a stem cell donor matched in the registries, we also look for whether there's a donor in the cord banks. And there are certainly out of India, a lot of what we call public cord banks, which means that the umbilical cord cells are collected for women who's had and put in the central cord. But I was in pediatric about 20 years ago at Hammersmith in London. That would be part of our duties, that if it's a delivery, we would collect the cord cells and we would give it to the lab people to freeze it. Now, we have a strange situation in India that we do not have a lot of public cord banks. In fact, I think we have none, but we have a lot of private. So I won't go into that. But if the question is how often are they used, in India, they are actually not used very often. And we can have an entire session why not, but basically there has been a new development in the world of transplants, which means that sometimes if we don't find a full donor in the registry, sometimes we can nowadays even look at doing a half match transplant at times. So it's still used, but not probably as much as it has been used in the past.
Thank you, Doctor. I think that was very insightful. We get a lot of questions about how is blood stem cell transplantation different than the cord blood one. Usually my answer would be that for an adult patient, it's not enough. So this is a different, especially with the haplo match, I think even in the families where you can do stem cell transplantation, but the key is to find a match, and your parents will always be a half match.
I mean, you're right. With a cord match, quite often the number of cells is not enough for an adult patient. The quality of cords that we get here, though it depends on the way they are stored, it's not that great. The length of time it takes for a cord transplant to actually grow and engraft is actually much longer than a blood donor or a marrow donor. So because of those reasons, we are seeing a huge drop in cord cell transplants, not just in India. It's everywhere across the globe. And if you look at the graphs, what we see is that cord transplants were there about 10 years ago. They are now gone there. And half match transplants are taking their place, really.
So I think Mr. Abhishek Gupta will have to, I think this might be the last question for the evening. I think from your experience, what is the success rate of blood stem cell transplants? I think that's what he asked, not the cord blood, but blood stem cells, yes. Yeah.
So the success rate is actually very good. I wish I could say, I hope someday comes when I'll say it's 100%, but we have to be pragmatic. So if we define the success rate being that we've done a transplant, and those transplanted stem cells have taken root, has engrafted, and we've been able to send the patient home, and we have a parameter called day 100 discharge survival that the patients find and gone home. That's actually very high. That's approaching about 90-95%. So which means that our success rate in terms of getting a patient well, the cells have engrafted, the patient's going home, is really very, very high. It wasn't this great about 15 years ago when we would talk about 70% success rate. Nowadays, when you talk about any transplant program, we always have 90-95% success. There is one more thing, that if we are talking about transplant success in malignancies, if we follow them up, there is certain number of patients in whom the disease might come back, but that can happen with any cancers anywhere. But stem cell transplant success nowadays is actually very good. It's very high.
Okay, doctor. So I think that was the last question for the day. And yeah, Abhishek says thank you for addressing his question. So thank you, Dr. Sen, again, and thank you, Dr. Ashta and Ruchi for coordinating with me, and Saurabh also, who initiated this request for the webinar on today. And thank you for everyone who's been patient enough to listen to us and be with us till the end. I hope that you've learned something new and you can take it home and tell more people about this. You can always reach out to DKMS, BMST, or Core Diagnostics if you have any other questions or any other initiatives that you would like to take similar to this. Thank you, everyone. Have a good evening and happy weekend.
Thank you so much. Thank you.
Thank you.
Thank you, Nisha. And I would also like to thank DKMS for collaborating with us. And we look forward to many such insightful sessions in future. Thank you, Dr. Sen. Thank you, Dr. Astha, for taking out valuable time from your busy schedule. Thank you. Have a good day.
Pleasure. Thank you. Bye.
Bye-bye.